The histopathology of the liver in naturally infected canine babesiosis that died. The aim of this study is to describe the histopathology of the liver in naturally infected dogs with canine babesiosis that died. The objective is to describe the histopathology of livers from canines infected with Babesia rossi and then compare them to normal livers from a cohort of healthy, non-infected canines. The variables for the study, the independent being the person who will be evaluating the liver samples, which is myself, Dr. Horrell. Therefore, there'll be no discrepancies between the subjectiveness of those evaluating the samples. The second independent variable would be the animals from which the control samples are taken from. The dependent variable being the degree of morphological differences between the liver samples, dependent on severity of disease. From the literature available, we hypothesize that there will be morphological differences between the control livers and the livers infected with canine babesiosis. The naturally infected animals showing specifically centrilobular hepatosis and hepatitis, centrilobular congestion, an increase in the number of perivascular and parenchymal mononuclear leukocytic infiltrates, namely eosinophils, lymphocytes, plasma cells, and histiocytes, hypertrophy of the Kupffer cell population, an increased number of phagocytosed erythrocytes present, increased extramedullary hematopoiesis present, an increase in cytoplasmic vacuolation and hydrophobic degeneration, and some degree of hepatocyte necrosis and apoptosis. The null hypothesis for this study will be that there will be no discernible differences in the histology of the diseased and controlled liver samples, while the alternate hypothesis is that there will be discernible differences in the histology of the diseased and controlled liver samples. This is a semi-quantitative, retrospective, case-controlled descriptive study. The experimental animals have already been sampled by Prof. Lysowitz during previous research. These animals were sourced from the Onderstepoort Veterinary Academic Hospital in Pretoria from patients that were treated and died or were euthanized there. Post-mortem tissues were collected, formalin fixed, and paraffin wax block embedded before being archived. The liver tissue of 20 of these dogs will be used. The control canines will be limited to healthy animals based on hematological and biochemical screening. Hemoparasites will be ruled out by PCR and RLB. These animals will be sourced from the Tshwane SPCA. Animals included will have been euthanized for welfare reasons, such as they cannot be rehomed, as determined by the SPCA management. The inclusion criteria include 20 client-owned dogs naturally infected with Babesia rossi that presented for veterinary care, dogs that were diagnosed with Babesia rossi on a peripheral blood smear and was confirmed on PCR retrospectively, dogs that died due to the infection or were euthanized due to owner's financial constraints, dogs of any age, sex, breed, and body weight, dogs from which samples could be collected within 90 minutes after death, dogs that received treatment for babesiosis as well as those that did not, and dogs that have owner consent for full hematology profiles to be run and full postmortems to be conducted. The exclusion criteria include dogs that were subsequently proven on PCR to have other hemoparasites such as Babesia bergeli, Ehrlichia canis, Anaplasma, or Thaleria species, any dog that received any anti-inflammatory medication 4 weeks prior to presentation, any dog for which a complete set of records was not collected, dogs that were found to be suffering from comorbidities as discovered on post-mortem examinations, dogs that did not have post-mortems performed within 90 minutes after death, and dogs that had any hematological abnormalities as discovered by the complete blood count. The inclusion criteria for the control animals include attempts will be made to match the physiology of the experimental canine samples with regards to sex, age, and whether or not they are sterilized, dogs that are due to be euthanized already, and dogs that are clinically healthy and show no other comorbidities on ante-mortem, hematological, PCR screening, and biochemical results, as well as on postmortem. Exclusion criteria include dogs that are deemed unhealthy on clinical examination or have any inflammatory processes present as determined at postmortem, such as neoplasia, disease, organ failure, severe helminthiasis, etc. Dogs that test positive on polymerase chain reaction or reverse line blot for any hemoparasitic infection. Dogs that have